talking with experts to get COVID-19 advice as the Delta variant surges. Now, joining me now is Dr. Jorge Salinas with Stanford Healthcare. Thank you so much for joining me this morning. Now, doctor, cases are rising again. In some cases, rivaling what we saw last summer before there was a vaccine. New York City is going to require proof of vaccination to get into places like restaurants and gyms. First of all, do you think that's going to work, and should we possibly try that out here?
It is true. Good morning. It is true that cases are going up and that we need to continue trying new approaches to incentivize vaccination. Vaccines are the key strategy to prevent transmission of COVID-19 in the community. And I think that, yes, requirements, mandates, or hints for people to get vaccinated, to be able to partake in socialization in indoor settings may be reasonable. I think that what New York City is doing is fair, is a fair strategy, and I think that other places are likely to follow suit.
Let me just ask you a quick follow-up question on that, though. But do you think that those mandates, the requirement that you need to show proof of vaccination to get into a place, a restaurant, or maybe a show, is that about keeping people safe? Or is that really sort of about kind of nudging and, quite honestly, pushing people to get their shots?
Well, it's both. It's both. By encouraging people to get vaccinated, you're making them safe. And by them being safe, people surrounding them are safe as well. So absolutely, it is good for them individually, and it's good for society.
All right. Let's switch gears a little bit. The new school year is just around the corner. A number of school districts are considering making the vaccine mandatory for teachers and for other staff at those schools. Now, do you think that this would help to protect students? Because many of them, aren't eligible by age yet to get a shot.
I think so. What matters at the end is the number of people and the proportion of people who are vaccinated. Whether you accomplish that with nudges or with mandates is slightly less relevant. But it is clear, the science is very clear, that if people are vaccinated in the school environment, let's say, it's going to be safer. For sure, it's going to be safer for the teachers. It's going to be safer for the students. So yes, I think that maximizing the number of people who are vaccinated among the eligible is the way to go.
All right, so mask mandates, they're back here in the Bay Area. Some people, well, they really never stop wearing them, myself included. Others are likely to be a bit frustrated to see masks return. But my question is, who is being protected by all of this? Is it the unvaccinated? Is it children? Is it the vaccinated from breakthrough infections? Who are we protecting with bringing masks back for everyone?
That's very interesting. In public health, we do things for ourselves and we do it for others as well. So everybody wins. Similar to vaccination, everybody wins when we wear a mask. A mask is protecting you in the rare instance that you may be exposed to COVID. It also prevents, in the rare instance that you have COVID, it prevents you from spreading it to others. So yeah, it helps everyone. It helps you if you're vaccinated, because nowadays we know that with the Delta variant, there are some cases. It's still not very frequent, but there are cases of COVID among people who are vaccinated. So the mask protects you. And if you were carrying COVID, the mask prevents you from spreading it to others. So yes, it works both ways. It's good for you and it's good for society.
Yeah, follow-up question. It's my understanding that one of the reasons that public health officials kind of reversed themselves a little bit and then went to recommending masks for everyone was emerging evidence that people that were vaccinated might still be able to kind of catch COVID, perhaps sometimes being asymptomatic, didn't know about it, and potentially spread it to others. What do we know about that?
Well, that is correct. That possibility existed before the Delta variant. It has become slightly more likely with the Delta variant, but still, it's very difficult. It's a difficult messaging. It's a messaging challenge because vaccines still work. They still prevent infections. They definitely prevent severe infections, prevent the need for hospitalization and prevent death. But it is true that with the amount of virus circulating in the community, there will be some people who, even though are immunized, may get COVID.
Now, there's never really been a true scientific consensus about what the threshold was to reach herd immunity. We heard 70% maybe on the low end. Now we're hearing maybe 90% on the upper end. What do you think it's ultimately going to take? And that's an important question because that's the goal that we have to set for ourselves. What percent of the population need to get a shot before we reach herd immunity and presumably bring this back under control?
I think that the concept of herd immunity is interesting from an academic perspective. I think it is slightly, it's going to be slightly difficult to get to that ideal state as a society. I think that what we're going to do is mitigate the impact of the virus, reduce or to the smallest number possible, the number of people who die from COVID or who need to be hospitalized, reduce the number of cases. But as long as there is COVID circulating anywhere in the world, there will be the risk of COVID being introduced in the United States and little outbreaks or big outbreaks happening in the future. So I don't think that that there is a whole lot that we can do to make it go away for good. I think it's likely that this virus will continue circulating among the human population for the foreseeable future. But what we can do with immunization is make it difficult for it to be transmitted and make it very difficult for it to cause severe disease, hospitalizations, and deaths, which is still a exceedingly great goal in America and around the world. We have to remember that there are hundreds of millions of people who are not eligible around the world. They are elderly or they work even in healthcare and who don't have access to vaccines. So as long as they are not vaccinated, the virus will continue circulating in those other settings, and new variants could emerge that could eventually come here, no matter how high the vaccination rate is. So we need to start getting used to the news that COVID will continue circulating, and our job is to mitigate, to reduce the impact of COVID in our society. And we do so by vaccination. We do so by following public health advice, wearing masks when the incidence of COVID is high enough in the community. And we'll probably have to go, as when you drive a clutch car, you're going to have to push gears back and forth, depending on what's happening in terms of transmission in the community, in terms of new variants introduced in America. But I think it's going to be difficult to reach a number, 90%, 100%, and still know for a fact that COVID is gone. I don't think that we'll have that certainty unless we were able to vaccinate the vast majority of humans around the world.
Do you think we need to change the messaging? Because I think that this concept of herd immunity, like if we got 70% of the population vaccinated, that 70% would then effectively sort of protect everyone else. Do we need to kind of tell people, listen, if you're not vaccinated, no matter what the vaccination rate is, you're not protected? And do you think that sort of this idea of herd immunity sort of took some people off the hook because they thought, well, if the vaccination rate is 80% and I still haven't got my shot, I'm fine. I don't really need to.
So having a high proportion of people immunized definitely helps. It makes it harder for the virus to circulate. It reduces the number of people who may get severely ill if they were to catch COVID. So definitely we need to continue aiming for having a high rate of vaccination. But it is becoming more and more obvious that no matter how high the number of vaccinated people we achieve, that there will continue being a risk of the virus circulating. If not in the previous versions of the virus, perhaps with novel variants of concern as they continue emerging from uncontrolled circulation of the virus in other settings. So America needs to clean the house first. We need to do a better job in reaching people where they're at with information and with vaccines to get a very high level of immunization here in America. And very quickly, we need to go and help people abroad to control their outbreaks, to control their transmission, because otherwise new variants may emerge, and that puts our progress at risk.
Well, if we didn't have enough to worry about, the Delta Plus variant has been detected in South Korea. What do we actually know about that?
So viruses, and the coronavirus is just one example, continue mutating. They start developing these changes in the genetic material that sometimes confer the virus certain characteristics to either become less susceptible to immunization, less susceptible to some of the monoclonal antibodies that are used as treatment, and overall that may help the virus increase its fitness, increase its capacity to transmit, to infect others. So again, it shouldn't surprise us. We will continue hearing about new variants emerging. And all that means to us is that we have to remain flexible, continue assessing the epidemiologic situation in America and around the world, and again, do our homework, clean the house, get as many people immunized in America first, and then go help the rest of the world very soon, because you cannot eliminate COVID from America if you don't accomplish those two things.
All right, doctor, thank you so much for your time. I got one last question before we go. It's about vaccine durability. Basically, how long does the vaccine last and its benefits last? And I guess the question is, what we're hearing is that it begins to taper off over time. When do you think that people perhaps should get a booster, and when will that become approved, do you think, by the medical establishment?
It's difficult to tell. It is possible that, yes, that some levels of antibodies decrease or wane over time, but the immune system is very complex, and there are other types or other parts of the immune system that continue working, that have memory, that will remember how to fight the coronavirus. So it's not very clear yet that all of us need booster shots. We don't know that for a fact. It is possible that some individuals who were not able to mount a robust response to the vaccine because they are immune suppressed, transplant patients, for example, may benefit from a booster, from a third shot. But again, I think that the end game is to get as many people vaccinated with at least one or two good doses, depending on which vaccine we're talking about, around the world. I think that that's going to have a greater benefit for society, for all of us in the US and abroad, rather than trying to focus on maximizing our antibody levels to prevent an infection at the individual level. We have to, with epidemics, we have to think as a pack, and the pack is safer if we reach a high level of immunization in as many people as possible. So I think that should be a higher priority versus aiming to get third shots to everyone. I don't think we're there yet, but yes, scientifically it is possible that the immunity may decrease a little bit, especially regarding infection, the possibility of acquiring the virus, but immunity appears to remain strong against the most meaningful outcomes: severe disease, the need for hospitalization, and mortality, which is still good news. So vaccines are still good. Please go ahead and get them. They are one of perhaps our strongest tool to fight this pandemic.
All right. Thank you so much for your time today. I hear exactly what you're saying. I also think that vaccinated people would gladly get a third shot if it upped their protection moving forward as well. And it may be a little bit of an easier sell. But thank you again. Dr. Jorge Salinas, thank you so much for your time today.
Absolutely. Nice talking to you.